Welcome. First, I hope everyone is healthy and safe and doing what they need to stay that way. My name is Andrea Ray, and I have the pleasure to serve as the President CEO at the Seattle Southside Chamber. And on behalf of our board and staff, welcome to our SMART Southside Mitigation and Recovery Task Force webinar on reopening strategies for your business. Thank you to our sponsor, South King Media, and Scott and Teresa Schaefer, who have been tireless advocates for our community. As small business owners themselves, they are dedicated to helping other small businesses grow, as well as keeping our community connected and informed. Through the miracle of technology, Scott is now broadcasting our webinar live on Facebook so that even more people are able to connect with us and ask questions. So thank you, Scott. Our webinar series is a strategic initiative dedicated to our mission at our chamber to connect, convene, and create economic opportunity for South King County. That mission hasn't changed with the pandemic, but our delivery methods certainly have, and we're grateful that you can join us today. Information sharing, education is a huge part of our work here at the Chamber, and we will continue to do all we can to provide resources and benefits to our community to help you make the best decisions for you, your business, your employees, and your customers. That's what we've done since 1988 and what we are committed to doing now and in the future. Each week, SMART will present a new topic on a subject impacting our community. Next week, we hope you'll join us as we look at what some of the legal issues are as we relate to this crisis and prepare and respond. You can register for all of our webinars on our website, seattlesouthsidechamber.com. We know providing opportunities to share information and connect will make our community stronger and ready for recovery. We hope you can join us for more of these opportunities. And if you or your company is able to donate or sponsor our work so that we can continue to serve our community in, and most importantly, through this challenge, it would be greatly appreciated. Every little bit helps to keep our nonprofit strong and to be able to serve you and our community. So thank you. Renata Emerson is our amazing Director of Membership and Programs, and she is here just to give us a little bit of housekeeping on what to expect for the webinar. Renata?
Thanks, Andrea. Welcome, everybody. Thank you again for being here and being a part of our webinar series. We're excited to get this information to you as a resource and just additional information for you guys. A few housekeeping items. All of the participants who are on today, you're all muted and you will just be able to view. We will be having Q&A after the presentation, and so if you go down to your menu at the bottom, you'll see a Q&A box. Go ahead and click that, and at any time you are welcome to add your Q&A question there, and I will be facilitating and monitoring that. So when the time comes, we'll be able to address your question accordingly. We are also currently streaming live on Facebook. Hello, Facebook. And so, again, thanks to South King Media and the B-Town blog for making that a possibility for us. You can, if you're watching live on Facebook, you can type in your questions in the comments there, and Scott will be moderating that and forwarding questions to us from there. If during the Q&A portion you've asked a question or you're needing clarification or you wanted to have a quick add, we have a capability to raise your hand. And so if you head down again to the bottom of your screen where the menu is and click Participants, you'll be able to see an option to raise your hand or lower your hand. And so if you want to give that a test, you're welcome to do that right now. Otherwise, I will keep an eye out for any hands that are raised and make sure that we can get any clarifying questions answered for you. With that, I am so happy to welcome and reintroduce Andrea Ray, who is our subject matter expert for today. She's going to be talking about reopening guidelines, considerations, and strategies for this phased approach in Washington. So, Andrea, back to you.
Perfect. Thank you, Renata. So again, today we'll take a look at how the business community is responding to the governor's phased-in approach for reopening and share guidance on what businesses should be planning for and also what consumers can expect as we continue to move forward and adapt. We are all anxious to start reopening our local economy and to do it in a way that is safe not only for our businesses and our customers, but also our employees and our whole community. We have created this presentation as an overview and a framework for consideration. And we use the governor's Safe Start Washington guidelines, trade associations, the U.S. Chamber, other chambers, a business checklist compiled by the Boston Consulting Group, Challenge Seattle, the CDC, and OSHA, all in an attempt to review and distill the current guidelines and recommendations so that we can help you plan and prepare to reopen. This presentation should not be construed to include legal or regulatory advice or recommendations on how to address the COVID-19 situation specifically for your business or employees. Each business is responsible to seek appropriate and up-to-date guidance and, of course, follow all the rules from the authorities before implementing any measures. And we are happy to work with you and refer your business to the appropriate agency for guidance or to provide any other technical assistance, and we'll get to that later. This crisis, we know, is dynamic. And as new data and information becomes available, the protocols and guidance also evolve. Businesses are unique, and guidelines purposefully have nuance built in. And this presentation provides a snapshot for today. And although I would love to say that we can predict or forecast what might be, we unfortunately cannot. So please also note that this is not medical advice or safety advice, nor is it an endorsement of any particular policy. As such, you are advised to make your own assessment as to the appropriate action for you to take and using this presentation as guidance. But again, please carefully consider local laws and guidance in your area, particularly the most recent advice issued before making any decision. And again, if you have any questions or you are unsure, please contact us and we will help you. Okay, so now that all the disclaimers are out of the way, let's dive in. So first, we're going to start with an overview of what is the governor's Safe Start Washington program. And the program includes guidelines for businesses and individuals, as well as outlines the 4 phases. In general, it attempts to modify physical distance measures to minimize the health impacts of COVID-19. And the goal is to protect the vulnerable, preserve capacity in our healthcare system, and involves assessing disease activity and testing capacity before relaxing or easing the social distancing measures and moving on to further phases. One aspect of the phase-in approach that must be considered is the COVID-19 disease activity. So before reopening Washington and modifying those social distance measures, we will be looking at COVID-19 disease burden and making sure that it is low. And so how they're measuring what that disease activity is based on a formula and a calculation that takes into account the number of cases, hospitalizations, and deaths in Washington state. It also includes modeling data from the Institute of Disease Modeling and Puget Sound area rates of spread, University of Washington Institute for Health Metrics and Evaluation. And it also takes into account WSDOT traffic data and Google mobility data. And so based on all of that, they get a formula for what is that rate of disease activity. And obviously the rate of disease activity needs to be low before we can reassess to go to the next phase. So next slide, please. Another aspect of the program, along with measuring disease activity, includes the readiness and capabilities needed to respond. And so the 4 key areas that are included in readiness are healthcare system readiness, that's testing capacity and availability. There's case and contact investigations, and the ability to protect high-risk populations. And we'll go over all those in the next few slides. So the first, healthcare system readiness, and we've certainly all heard a lot about making sure that we are flattening the curve to preserve the capacity for our healthcare system. And we need to do that to ensure that we have adequate bed capacity, staffing, supplies in our healthcare system to handle a surge in COVID-19 cases. And so we measure healthcare readiness by the number and percentage of licensed beds and ICU beds available in our local hospitals, number of available ventilators, the days that we have of PPE supply available in hospitals and long-term care facilities and other healthcare settings, the ability for the state to fill high priority PPE requests, personal protective equipment from local emergency management agencies, and then of course the ability of hospitals and other healthcare facilities to surge and coordinate the movement of patients. Next slide. Second, testing capacity and availability, right? So we've all heard about what the testing capacity is in Washington State and how that needs to work. And obviously the ability for everyone with COVID-19 symptoms and those with high-risk exposures need to be able to be tested immediately and to test and receive a rapid test results. So that's key to being able to, again, keep the disease rate down. So geographic distribution of testing sites, able to serve the entire population, the number and capacity of laboratories in Washington State performing those testings, the ability of the elements needed to prepare the test kits, such as the number of swabs and other materials needed to create the test kits, and then also it's the number of tests that are performed each day. The third piece is the case and contact tracing. And so the ability to rapidly isolate those who are sick with COVID-19, identify and quarantine who they've come into contact with, and then provide case management services is very important to the process as well. And so that will be measured by the number of investigators who are trained and working in contact tracing. Certainly we need the people to do the work to be able to have successful contact tracing. Plans for case management, the isolation and quarantine facilities. So we know King County has created isolation and quarantine facilities, one in SeaTac, there's also in Renton and Kent and throughout all of King County and Washington State. The establishment of those quarantine facilities is really important. And then again, it's the percent of cases investigated within 24 hours, right? So we want to be able to do that contact tracing quickly so that that person who is sick, we can contact those people and keep that risk small. So again, you imagine ripples in a pond. We want to be able to stop the ripples before they get too far out. That's what contact tracing allows us to do. And then we're on to the next slide. And this is the fourth piece of healthcare and system readiness, and that's our ability to protect high-risk populations. So we know a huge epicenter for the epidemic in our community was the Life Care Center in Kirkland, and we need to be able to protect people in these high-risk situations. And so that includes being able to manage the number of breakouts that might happen in long-term care facilities, collecting demographic data and hospitalizations, reducing deaths. And then the ability of local and state, what we would call, strike teams, to go into a facility if they are experiencing an outbreak to respond adequately. And we need that also to happen within 24 hours. Next slide. And so again, that is part of what we need for the system readiness. And then there are things that no matter what phase we are going to be in phase 1, 2, 3, or 4 that all individuals and businesses, are going to need to do to maintain, that safety and that protocol while we are still, going through the recovery phase. And so this includes heightened protections of the health and safety of workers. And we all have a responsibility to protect ourselves and others throughout each phase. So simple guidance for individuals throughout all phases are going to include social distancing measures, wearing face coverings. We all saw May 18th in King County. That's going to be a new requirement. Certainly stay home if you're sick, avoid other people that are sick. Again, wash your hands, right? Respiratory etiquette, sneezing into your elbow. These are all things that we're going to have to do, throughout the phase. Next slide, please. Requirements for all employers, right? So throughout all phases, employers are also going to have to find ways to maintain social distance for employees and for patrons. Other considerations, could be barriers. We've seen a lot of the plexiglass barriers that have gone up, for businesses. That helps absolutely to just protect the customer and the employee. Provide services, without creating close interactions with patrons. Obviously, sanitation policies are going to be huge. So ensuring that, workers, vendors, patrons have the ability to wash their hands and use hand sanitizer. Quickly and frequently disinfecting the business, especially, high touch services is very important. Having PPE and face coverings for employees and customers. Certainly making sure that you are up to date with all of your sick leave policies for your employees, and making sure that they know that they need to stay home, if they are sick. Educating employees on what those policies are and what the best practice is really important. And then, of course, for workers also, being able to, again, if you are sick, to stay home and to, understand, what your rights are as an employee. And if you have any questions or if you have any concerns, certainly you can, again, reach out to us, or there are lots of other resources available. Washington State Department of Labor and Industries has a really great, guidance, on their website. As well as the Washington State Department of Health, Workplace and Employer Resources and Recommendations. Next slide. And so now we start to get into these phases. So again, here we are in phase 1. Phase 1 we know will last until at least May 31st. Given all of the considerations before, again, disease rates stay low, capacity with our healthcare system, stays high, then we're able to go into, future phases. And so you continue to stay home, stay healthy. We know some outdoor recreation is possible right now, hunting, fishing. We still cannot gather in groups. We're still restricted to only essential travel. Essential businesses are open, but construction has resumed, some, not all. Landscaping, auto sales, car washes. Certainly we have, retail now and restaurants that for curbside pickup, pre-orders, takeout. And then pet walkers, are also able to work now here in phase 1. Moving on to phase 2, which, again, could be, fingers crossed, June 1st, would be, again, encouraging everyone to continue to stay home and stay healthy as much as possible. Outdoor recreation with fewer than 5 people, that can resume, and could also even be with people outside your immediate household. So camping. So I know a lot of people, probably had Memorial Day camping, plans. That was canceled because of the extension of phase 1. But, again, hopefully once we get into phase 2, people can go back to camping. Gatherings with people outside your household, again, with no more than 5 people, that can happen once a week. And then limited non-essential travel, within the proximity of your home can also happen. So we get to kind of, open it up a little bit more. Again, for businesses, new construction can start back up, manufacturing, in-home and domestic services. So nannies, house cleaning. I know a lot of, people are working at home and they also have kids. And so it's been a challenge. So being able to bring nannies back into the home will help. Retail with in-store purchases allowed. And again, there'll be restrictions, but retail will be able to resume. Real estate. So again, some residential real estate has been able to proceed with some guidelines. Commercial real estate will be able to start again. And then professional services, again, and we'll get into that, barbershops and, salons. We'll be able to start again. Office-based businesses. So again, the governor has said teleworking is still encouraged, but not required. And so that would be phase 2. Restaurants also to say as part of phase 2, this is where they would open at 50% capacity and parties no larger than 5. And then we get into phase 3, which again, maybe could be as early as June 22nd. Again, advice to continue to stay home, stay healthy. All outdoor recreation and sports activities with 5 to 50 people can resume. So thinking about, soccer games or, basketball games. Recreational facilities need to maintain 50% capacity. So, public pools would need to reduce their capacity. We can have gatherings again, right? So as long as there are no more than 50 people, 50 people can gather again. We can resume all non-essential travel. And then businesses, restaurants would be able to go from 50 to 75%. They would be able to go from parties of 5 to parties of 10. And then bars would be able to resume at 25% capacity. Indoor gyms, 50% capacity. Movie theaters, 50% capacity. Government work would resume. So a lot of our government work has been halted, and only activities that are COVID related or usual and customary can happen. Government will be able to resume, discussing new items, right? So that work will continue. Libraries, museums, and all other businesses basically will be able to reopen in phase 3, except for nightclubs and events or festivals that would have more than 50 people. And then that final phase, phase 4, which again, might be as early as July 13th, we would resume all public interactions, again, with social distancing. All outdoor recreation would be open, all gatherings with over 50 people, all non-essential travel, and clubs, concert venues, large sporting events. Those would all be able to continue as well. Next slide, please. So then we get on to, again, with the phased-in approach, counties can request a variance. So if there are 75,000 people, or less in the county, again, some of them are saying, well, can't we move a little bit quicker, in this phased-in approach? If our disease rate is lower, how do we go about doing that? And so there is a process for counties to apply to move more quickly in that phased-in approach. I believe there's 8, right now who are kind of, jumping ahead a little bit. For our purposes, here in King County, our disease rate still is a little bit high. It's over 1. And so what that means is the reproductive rate is over 1, which means that if one person is sick, they are infecting more than one other person. And so we really want to get that down to be able to move into those next phases. And so unfortunately, I don't see King County being able to apply for a waiver anytime soon. But 8 counties have, and they will continue to go through that process to request a waiver. Next slide. So again, I think with everything, we really focus, first on safety. Job safety is huge, no matter, what your business is or what your occupation. And so how do you begin to prepare to reopen, given all of the uncertainty of when and how, and the reality is that no one knows how long this will last, and that we all do want to be safe. And so here are a few tips to consider as you think about reopening. And again, it's first to start with workplace safety. So again, adhering to all of the federal, state, local guidelines, being able to encourage the work from home for operations as much as possible. If the work can be done from home, really asking yourself, why would I require that to happen somewhere else? Maintaining that physical distance, right? So that's very important, and might require some, rearranging of, your office or the interior of your business to be able to maintain that physical distance. Avoid gatherings, right? So places where people would naturally congregate and gather, the lunchroom or a lobby or, cafeterias, right? Really think about, how can you maintain that social distance and really encourage people from gathering, which is just a natural human thing that we want to do. So how can you keep that? Again, routine sanitation. So high touch surfaces, routine it so that it's part of a policy and who's doing it and someone is assigned to do it. Ask workers and volunteers to self-certify that they're not sick, that they don't have any symptoms of the virus. And then, of course, asking workers to stay home if they are experiencing symptoms. And then respond to protocols and have the ability to log all workers and volunteers that are coming into the business. Again, that availability, to contact workers or volunteers or visitors is an important part, of that contact tracing. And then again, it's regularly monitoring, what updates happen. And then probably most important with any workplace safety plan or protocol is the communication plan. And so having a team meeting, having a work group that can focus on, staying up to date and managing this for the team, for the business is really important. Along with, providing, masks and face coverings for people that need it, potentially offering alternative work assignments, right, for people who are high risk. If you have the ability to take someone who has a high contact job with the public and put them into a lower contact position, and they are in a high risk group, really thinking about and making that available is good. And then again, the training, not only communicating with the employees about what the safety protocols are, but then training on that as well to make sure that they're being consistent. And then also communicating to the customers, right? So it's not enough just to communicate internally with your employees. You need to be able to communicate to the public for, what is their shared responsibility for keeping everybody safe. Next slide, please. And so creating a checklist is good, right? Because there is so much information and that information is going to need to be, updated and monitored. And here's a couple things, again, that we've talked about that should go on your checklist. And so one, again, encouraging proper hygiene and health practices. Encourage workers and volunteers to do temperature checks at home before coming to work. Avoid any non-essential person-to-person contact. No handshakes for a while. So we're going to be doing the elbow bump for a while. Again, health screenings on premises. So, those routine checks, enabling tracking and tracing so that you can notify workers or customers, if something does come up. Sanitation procedures, limiting shared office resources. So, again, as much as possible, limiting that time, in the mailroom, the time in the lunchroom, vending machines, really consider, limiting that access, because the more high touch items you have to clean, it's going to take you a lot longer to clean them, and then also, maintain those protocols. So, limiting those high touch items is going to be really important. again, enacting what those social distance measures might be. So that includes reduced capacity, right? So that's staggering times for your employees to come in, and also staggering appointment times. Limiting how people enter and exit the business, right? So again, obviously wanting to maintain, fire code standards, but ensuring that there's, the one-way paths, right, are important, because that eliminates or helps to reduce what could be an accidental, close contact situation. Encouraging the no contact, payments and pickup programs as much as possible. And again, it might involve, reorganizing some of your floor plan to encourage that. And again, continue to telework as much as possible. Again, when you're creating your safety committee, working on this project, really appointing someone, who can be in charge to ensure that all of the policies and practices are being implemented in the way that they're meant to be. Even us, we have a staff of 4. Cindy Joaquin, our amazing, director of finance, she is our safety captain, right? So she makes sure that all of our flashlights, have working batteries, that we have bottled water, food, and she's also ensuring that we're following, sanitation practices. So even in a small office environment, really, giving that person that authority to help make sure that those practices are taking place is really important. Next slide, please. So again, just like with any new policy or procedure that any business might have, you do need to think about, there's an analysis, there's a design, a development, an implementation, and an evaluation phase, right? So this is not a one and done, and all employers should think about and develop their own checklists and how they want to manage and monitor and evaluate, what the system is, because you might implement something that follows all of the CDC and OSHA guidelines, but it might not quite be working right for you and your business, right? So having some time and having that capability and the capacity to do that evaluation and to do that analysis, and then tweaking it as necessary and makes sense, is going to be good for your business and then also for your customers. Next slide, please. And so Office Space, right? So one of my favorite movies. Here's some guidelines for the different sectors we'll kind of roll out. And again, we know we're not going to hit every sector with this presentation. We don't have time, but we're going to hit some of our main sectors within the Seattle Southside community. And so office, right? Office environment. We have a lot of office in South King County. So again, screening for symptoms. So screening for symptoms, no matter what, is really important. So you need a plan and a protocol for screening for symptoms. And then as much as possible to implement that flexible sick leave policy. You do not want someone, coming to work when they are not feeling well. You want to give them that security that they are able to, stay home, work from home if they're not feeling very well. So again, it's reevaluating your policies and your procedures and really screening for symptoms. Again, encourage physical distancing. So think about maybe you bring back your employees in phased in groups, identifying those, key staff that we need to start first. Again, what's your team that's going to be doing the safety committee and the protocols, and then, rotating them in, allowing them to come in and evaluate the floor plan of the office to make sure that it's fitting all of the guidelines. Considering, adding those physical barriers. So within the last, 10 to 15 years, the open office environment, has been, very popular. So we went from, having 400 square feet per employee, in the 80s to now, having around 100, square feet or less than 100 square feet, per employee in the standard office environment. And so we have less space because it's more shared space. And unfortunately, shared space is not good right now. So we really need to find a way to create more physical distance. And if we can't create that physical distance, to put those barriers up. So that's where we go back to the cubicle model, unfortunately. unfortunately, at least temporarily. And then again, prioritize hygiene protocols, right? So, prior to reopening, you're going to want to deep clean everything, leave disinfecting materials around for high touch surfaces, lots of hand sanitizer, and again, encouraging employees, to wear face masks. And then again, using signs and communicating to employees, what the guidelines and best practices are. Next slide. And then food service, right? So again, we have, a fantastic, restaurant and food service industry in South King County. And so again, same thing. First and foremost, screening for symptoms, right? If you're sick, you're not coming to work. If I see you and you look sick, right, you're not working. So really being proactive with screening for symptoms. And that includes temperature checks, visual inspections. And again, you're going to want to limit, high-risk staff as much as possible to have that minimal contact, with customers. And then especially cross-training. So again, cross-training for employees is always important, but, really taking some time and trying to cross-train as much as possible. If you only have one person in your restaurant that knows how to manage and book the reservation system, for example, and then that person goes down, that's going to be a problem for your business. So cross-train as much as possible. Again, encourage that physical distance as much as possible. Continue with the use of carry-out, curbside, delivery dining options. Again, encourage the reservations and the call ahead as much as possible to limit that time that they are in the facility. Maintaining that 6-foot distance between all parties. And so what's hard in restaurants is that it's not just 6 feet from table to table or chair to chair, but it's when you're sitting in the chair, right? So there's 2 people sitting in the chair, 6 feet from that. And so it does end up being, quite large. And so being able to manage and gather that. And then again, continue to prioritize, hygiene protocols, using single-use menus and condiments, as much as possible. And then it's that constant vigilance with hygiene as much as possible, and the communication to the customer as well as the employee about what the protocols are and what the expectations are. Next slide. And then retail establishments. So again, curbside, pickup for retail, is now. And with phase 2, we'll be able to start, in-store retail as well. And so again, you're going to hear some themes. Theme number 1, screen for symptoms, right? So you are screening all of your employees for symptoms. That is huge. And again, cross-training, right? You have one person that knows how to do the staff calendar or the staff schedule or do the bank deposit. You're going to want to cross-train, again, just in case, right? To make sure that is happening and you're able to do that. Again, maintain that physical distance. So you will probably have to, in your retail business, provide floor markings and signage, for that one-way, path, throughout the store. And then also the markers where people might congregate. So around the cash register or dressing rooms, and then also limiting what that capacity is inside the retail establishment so that you don't, it doesn't go away from you, right? So signage, markings, reduce capacity, and again, continue to prioritize hygiene and sanitation practices. Next slide. And then we have, high contact establishments, right? So hair and nail salons, barbershops, tattoo parlors, et cetera. Again, first and foremost, you're screening for symptoms. And so you're screening for symptoms for your employees, but then you're also asking and self-screening, for your customers that come in. So you're making a visual inspection, but you're also, asking a customer, how do you feel? Have you had these symptoms lately? And then if they say, yes, actually, I had the symptom, but I think I'm okay, be on the safe side and ask them to then just reschedule that appointment, when, they are sure that they are symptom free. And then again, encourage physical distancing. So you can see in this, photo, it's probably going to be every other stool, right? Where you're able to, serve a patron. So that means you're going to need to be staggering appointments. And you're going to be staggering staff. And then again, high touch items, brooms, vacuums, laundry, all of those protocols for, sanitizing are going to be really important. And every time someone touches it, it needs to be sanitized again. And also, specifically for salons, because there can be so much spray that happens when you're doing, shampoo. They're also actually recommending that you actually cover the whole face of the client with a towel to help prevent that from happening, within the business. And then again, prioritizing all of the hygiene protocols. And so, salons are already used to doing a lot of high sanitation requirements, but this might be even more, right? So this is, replacing gloves, with every customer, requiring the face masks of customers if possible. Again, it'd be hard to trim a beard, with a face mask on. So that, you can't do that. But as much as possible, gloves and face masks, and changing them between, every customer. Next slide, please. And so next, we're talking about entertainment venues. And so, some of these are going to be open partially, during phase 3. And then some, larger venues, won't be until, phase 4. But again, the steps are going to be very much the same. Again, number 1, screen for symptoms, right? Visual inspections, temperature checks. Again, high-risk employees as much as possible, limiting their exposure. Again, encouraging physical distancing, right? So here we have a picture of a bowling alley, every other lane, probably you're not going to be able to have, the number of parties and the number of people frequenting these entertainment establishments, at least for a while. That physical distancing is going to continue to be really important. Again, those physical floor markings are also important, so that you can see and the customers know, what really is, 6 feet. And so they can implement that effectively. And then again, reducing capacity and prioritizing hygiene protocols. So again, this is in all high touch surfaces, disinfecting areas between, each and every guest. As much as possible, again, requiring the use of that PPE, and using, again, the signs and the posters to remind everyone about what the best guidelines and best practices are. Next slide. Again, gyms and fitness centers. So at half capacity, during phase 3, same thing, right? Screen for symptoms. You're going to also be screening for symptoms again, for people that come into the gym. Again, it's limiting, that exposure is going to be really, really important, because gyms, especially in terms of encouraging that social distance, that probably is, it's probably, people aren't going to be able to just come to the gym and hop on the treadmill like they normally did, right? So some are going to have to be, put in different places and rearranged, to encourage that physical distancing. Classes, right? So yoga class, again, 6 feet between the people. And then it's also hard in terms of coaching or, personal trainers. There's a safety requirement that happens with needing to be closer than 6 feet when you're, spotting someone who's lifting weights, for example. And so everyone's going to have to take those precautions and do what's comfortable for them and what's safe. And that might mean, a different comfort level with different coaches. And so being flexible and encouraging, with that. And then, of course, prioritizing, hygiene protocols, encouraging, the sanitation of all of the equipment. Another piece would be really encouraging customers, to bring their own water, right? So a water fountain is a highly trafficked area in indoor gym. And it's also a high touch surface. And so as much as possible, encouraging or providing, bottled water, really encouraging people to bring their own water into the gym is really great. And again, signs, posters, communication, everywhere. Thank you. Next slide. And so finally, our last piece, truly to talk about is that we can have all of these strategies, have all these protocols, all of the policies, all the procedures, all the safety committees, and reopen, and then what, right? So the true concern, for our local businesses when we're talking to them, is not, it's not just when can we open, because and how do we open, because that's important, of course, but it's also how do we communicate and show our customers that we are safe, and we want them to come back and patron us. Operations at many businesses, are running at, 25, or 50%. And we know that's not sustainable. And, we want to be able to help encourage our businesses as much as possible to, increase that consumer confidence. And so one of the things that we've been working on, at our chamber is this idea of a Southside promise. And so we are able to come in and help you, communicate and find ways, that you can, create and enact, a protocol and a system for reopening that is not only safe, but then how do you communicate that to your customers, so they know that you are going above and beyond and doing everything you can, to keep them healthy and to keep them safe. And so we're here to, help you provide, signage, checklists, outreach, and a lot, again, good information. And where a lot of this information came from is from the coronavirus.wa.gov website, and that does have the specific standards by which each company must adhere to, and again, those policies, as I mentioned at the beginning of the webinar, are nuanced and were developed, in a very fast-paced, outreach environment, because it's necessary for us to move quickly. Normally, any change to a policy or a recommendation or a procedure, would take, at least, 6 weeks of stakeholder meetings and outreach. And, they basically did this, in 3 days, the governor's office with AWB, Labor, Department of Health. And so they know that although nuance is attempted to be, part of those procedures, it will not, and purposefully does not, capture, everything in the document. So I know we've been talking, to our photographers, right? We have amazing artists and photographers that call South King County home. Well, if they can go out and shoot, nature shots. But, what about, weddings or, senior pictures, and if it's parties under 5, right? So really trying to understand, where do they fit in the sectors, as the sectors are so broadly outlined. Acupuncturists are another example. Is that healthcare, or is that personal service, or is it a combination of the two? And so everyone is learning. Everyone is trying to resolve those questions as much as possible, and figure out how to respond as well as they can. Again, it's a really great resource, and there is a portal on there on the resource coronavirus.wa.gov where you can ask your questions. Some of the feedback that we've gotten from some of our businesses that have gone into the portal, you can ask for a waiver or you can ask a question. And so we're encouraging you to ask a question instead of a waiver as much as possible. And we can get into that a little bit later if there's some nuance in the Q&A. So next slide. So again, as I said, we do have a process for where, we can hopefully answer more of your questions and create more of a streamlined or a personal, guide, for you and your business. Again, lots of businesses are not going to fit into like, oh, here's the PDF for my business, I'm new construction, or here's the PDF for my business, I'm a restaurant. And even, again, we know restaurants are so varied in terms of what they provide, how they provide it, what their floor plans are. And so if you have questions, please just reach out to us and know that we're here to help you answer those questions more specifically. And I think we're available to take questions now. So again, thank you. That's a lot of information really quickly. And so I appreciate you sticking through with us.
Awesome. Thank you so much, Andrea. So we do have some questions that have come in on Facebook Live. So I will start with those. In the meantime, anybody that's here in the webinar, please feel free to use that Q&A feature to enter your questions here. And so I will start with this one from Facebook that says, what else is the Chamber doing to help local businesses reopen?
Awesome. Yeah, no, thank you. I appreciate that. So again, this webinar, is part of the Southside Mitigation and Recovery Task Force. And that task force is a public-private partnership. And we meet weekly and talk about, how can we better support, create, programs, campaigns, action items to help support our local business community. And so a lot of our work is focused on, quite frankly, just, sustaining our businesses until we can reopen, right? So that's part of our Keep Calm, Carry Out campaign, which is a marketing campaign to help support our local restaurants, or the Saving Local campaign, which is a campaign to help, all of our businesses that are customer facing, again, just continue to operate at even, a 25 or 50% capacity by, selling and, gift certificates and gift cards and things like that. And so that's a huge part of the task force, again, is in that sustainability for businesses. We're also working on a fund, Southside Strong Fund, to help, support, again, businesses. And then a lot of it is advocacy, right? So that's what you really don't see, front and center a lot. But we are meeting, at least 2 or 3 times a week with our local lawmakers. Again, we're trying to help them develop clear guidance and clear guidelines, that make sense to try to, reopen, again, as quickly, as seamlessly, as safely as possible. So advocacy is a big part of that. And then, again, certainly these information, informational webinars and education is huge. So making sure that you as a business owner have the data, have the information, have the resources necessary to be able to do your work as quickly and effectively as possible, right? So, you don't have to spend 8 hours on Google or email 15 people. Well, I just don't know how to do X, Y, or Z. You can, contact us and we can be that resource for you. So information, education, resource sharing, direct support, marketing and promotion, and the advocacy, is a piece of just, what, the Chamber has been focused on as we, get ready to help our businesses reopen. And again, that request that we talked about is something we can physically, also assist you, with what that reopening guidance is as well.
Excellent. Thank you, Andrea. And again, all the information and details of the different campaigns that Andrea talked about, you can find on our website at seattlesouthsidechamber.com/smart. I'll put that link up in the chat in a few minutes here, but that is a great place to see what the Chamber is doing specifically related to the situation right now, and a good place to keep up to date on what's happening.
And I appreciate that. And I think, kind of a follow-up to that, that question is, I think as a nonprofit service organization, Our focus is exclusively on helping to provide, the support, to the business community directly. Something that we haven't done a very good job of, quite frankly, is communicating, what that is that we do, right? So, I think we're trying to do a better job of that so that people know that they can come to us and that we can provide those, resources. But we're just so hyper focused on providing that direct support and assistance. So I appreciate the question.
Excellent. Next question also comes from Facebook viewer. It says, we've heard, oops, let me go here. We've heard a lot about how this pandemic is hurting businesses, but what about new opportunities for entrepreneurs? For instance, new business models. Have we heard anything directly related to that?
Yeah, absolutely. So I know, if you're a staff member or a board member, you've are on our task force, you've heard me say this a lot, challenges are opportunities, right? And they certainly are, because this pandemic has forced us to work in new and different ways, right? Companies that, wouldn't have thought that remote work was possible are now looking at, whoa, my productivity is up 30%, right? So I think that we're going to see a pretty, extreme change in that office market, right? I think that for us in South King County, there's a huge advantage because a lot of the reports are talking about a suburbanization of industry. Right. And so what that means is, again, social distancing, in Manhattan is pretty hard, right? And when you are, working in a high-rise building and only one person, in an elevator all the way up to the 54th floor, forget about it, right? I mean, it's going to take you all day just to get your employees, to the office. But, in the suburban market, again, we typically have, larger, floor plans. You can take the stairs because, it's only 7 or 8 stories, it's not 54 stories. That's easier and more able to manage. And, oh, by the way, more employees are, living, outside of the city limits as well. And so a big focus of what we're doing, at the chamber is talking about, how can we be more of a business and industry center, outside of the, downtown, kind of commercial centers that we're used to, of downtown Seattle and downtown Bellevue, for instance. So we do have a lot to offer, in our, office market, and in our ability to, provide, excellent, resources, to encourage more advancement in the South End in, a safe way, because business will look different. And again, encouraging that spirit of entrepreneurship, that's also a huge piece of what we do. Absolutely. So yeah, great question. We're, thinking a lot about that and how we can maximize our potential.
And I would just add to that, reach out to your chamber or your local business organization, because we're hearing from businesses that have specific needs or that maybe are looking to shift or pivot in a certain way, and they maybe don't know who to connect to about that. But because it's on an individual case-by-case basis, it may not be something that is widespread information. But if you, for instance, I'm as a membership manager, if you reach out to me and said, hey, I have these type of skills, I have this type of offering, is there anybody looking for that? Who can you connect me with? And absolutely, I'm going to be able to, pinpoint some folks. So stay connected with those resources that are in your community or that are nearby you. We have our contact information on the last slide here. So please feel free to reach out again. Always on our website, you can find information on how to connect with us. So that's just an add-on that I would say as well for that question. Next set of questions is actually 2 that are related to face masks and coverings. I'm gonna lump them together. And I know you talked about it a little bit, Andrea. The first question is, do you think Washingtonians will be required to wear face masks or coverings when outside of our homes anytime soon? And then the next question, I assume it's from another viewer, is asking, what are your thoughts on businesses giving away pandemic themed swag, like branded face masks. So
Yeah, I mean, I think again, it's a brave new world, right? So I've been on several webinars, and they're talking about, how the event industry is so different now, and the idea of going to a conference and getting your bag of swag that that has pencils and thumb drives and things like that, the usual kind of business swag. No, I mean it's all sanitizer and face masks, right? I mean that's probably gloves, right? I mean that's probably the future again, at least until, as we talked about before, there's an effective vaccine, there's an effective treatment, or we have that herd immunity. And so depending on what you look at, that could be as long as 12 or 18 months. So in the near future, I think we are looking at hybrid events with maybe again social distance measures and additional PPE, where that would be completely appropriate for people to be able to do that. Again, we're seeing a huge, even market increase. Louis Vuitton, they're making face masks. Gucci's making face masks. So, we are definitely seeing, a rise in the industry to do that. For us as Americans, we have a different kind of cultural association with covering our face. And so it definitely is different than other parts of the world that don't have that same, cultural association. But I think we should be expecting, and we should expect ourselves to, at least, for the near and potentially, longer term future, yes, require face masks. And I think, again, the King County guidance essentially is, you're being asked to wear a face mask when you're in an enclosed space. So when you are going to the post office, or you are going to the grocery store, outside, not as much. It's not as necessary if you can maintain that, that physical distance doing outdoor, recreation. But if you're going to be, in close proximity to someone, or you're going to be in an indoor area, then I think we can expect face masks. And not surprising, probably, see some, branded and some, designer ones. I mean, we're gonna see it all.
thank you, Andrea. This last is not quite a question, just a comment, but some good information. And while we're discussing this, I do encourage, if there's anybody else that had something that popped up or a question that came up, please, again, feel free to type that in here. And this one is from the Highline Heritage Museum, and they're letting us know that they're seeking stories and artifacts from this pandemic. And so, like, we hear almost every day the phrase unprecedented times. We are in unprecedented times, and it's true. And there really is something to be said about acknowledging where we are, what it even looks like, what we're dealing with. And so I give kudos to Highline Heritage Museum to say this is going to be something that will forever be a part of our history, our global history. So how do we capture that? So they're asking if anybody has artifacts or stories that they're willing to share, that they reach out. And so I've got an email address. I'll put that in the chat here. So just a follow up, Andrea, I don't know if you want to speak to or add anything to that.
Yeah, I mean, I think, sometimes, again, especially for us, I mean, we're, clocking in, over 100 hours, a week, just in the trenches trying to provide that support. Again, how do we keep our community healthy? How do we keep our businesses healthy? And sometimes you forget, I mean, we are living, through a pivotal moment, in not just US history, but world history. And acknowledging that, and finding a way to, give that the space and the recognition, that it needs. I know, I have 2 children, and, I know they will remember this, just like they will remember this time, and it will impact them in ways that we, cannot even fathom, again, similar to the ways that, the Great Depression, impacted, our grandparents, right? The way that, that behavior and going through, that crisis, you know, it creates an impact, you know, on you and your perception and how you go through the world. And so, you know, again, I think, you know, our responsibility is to find a way to try to take this challenge and again, create as much opportunity and positive growth and change, you know, for our community as possible. And, you know, again, we're only going to do that if we, you know, all work together. So again, you know, appreciate everybody joining and all the work that everyone's doing to, you know, keep our economy and keep our community safe and strong.
Well, Andrea, that was the last, oh, let's see. Yeah, that was the last comment and question that I received. And so I am going to go ahead and put the previous slide up that talked about where to go, how to find those resources that the Chamber is offering, and that link. So I'm going to get that up here right now. And Andrea, if there's anything that you want to add or wrap up with.
No, I mean, again, you know, just, you know, thank you for everyone that joined us, you know, this morning, for everything that everyone in our community is doing. As Renata said, you know, we're hearing from our businesses and our community members, you know, daily, you know, by the hour, you know, with what they're doing to be, you know, positive and respond, you know, not just to save their business, but to help their other local businesses, right? So, you know, our chamber was founded on the belief that we are better and we are stronger when we work together, and we will be resilient and we will recover quickly, you know, when we can all work together in greatest partnership and collaboration. So if anyone, you know, has any questions or, you know, or ideas or things that we should be doing or should be doing differently, again, you know, we're a community organization, a small nonprofit. So, you know, we would love to have any input or feedback, and just, again, appreciate everything that everyone's doing to, you know, shop local and support our local businesses and to keep our community safe. So thank you. And join us next week for another SMART webinar where we'll talk about, you know, what our, you know, the legal ramifications, you know, are, you know, with all of the pandemic. And the crisis that's happening. I know we've heard a lot about, you know, what's happening, you know, with the employment security fraud, you know, a lot of issues that have come up, you know, for businesses, you know, and employees related to, you know, questions related to legal issues. And so we'll have Darcel Lobo with DAL Law Firm, you know, she'll be going over some things to be thinking about, how to protect yourself, how to protect your business. And again, if anyone has any questions, any feedback, anything that we can do, we're here in service to you and our community. So thank you. Stay healthy, stay safe, wash your hands.
Thanks, everybody.
Bye. Thank you.